Well, if the FDA and CDC gives a thumbs up, children under the age of 5 will be able to get Pfizer vaccine. But many parents are still hesitant to give their kids a COVID-19 shot. And that's where Brigham Kiplinger comes in, principal of Garrison Elementary School in Washington, D.C., better known to his students as Mr. Kip, a.k.a. the vaccine whisperer. Mr. Kip has been advocating for kids to get a shot by calling and texting weary moms and dads for many, many months. Mr. Kip, thanks for being here.
Good afternoon. Thank you for having me.
Well, since the federal government authorized the vaccine for children 5 to 11 years old, and that was, what, 3 months ago, your elementary school, Garrison Elementary, has turned into a public health anomaly. And right now, 80% of the 250 Garrison Wildcats in grades kindergarten through 5th have at least one shot. How did you do it?
Well, Kira, we started early. As we knew that the vaccine would be coming online, we reached out to the city, and DC Health and Children's Hospital helped us to line up clinics right here in our gymnasium so that families could just stop in after dismissal at pickup time to get their shot and get a popsicle for the road. And shaping the path right to our door helped to remove a lot of the logistical barriers of outside of school appointments and increased our vaccination rate accordingly.
Okay, so it's the popsicle. That was the special thing that you offered. Of course, it always works. Now, on a serious note, the rate of vaccination overall for America's 28 million kids in that age group of 5 to 11, it actually remains even lower than health experts had feared. We were looking at the new analysis by the Kaiser Family Foundation. It's based on the federal data. It says only 18.8% are now fully vaccinated. Now, despite the studies showing this shot is safe for kids, why do you think parents are still putting up a fight? And what was it you said that convinced your parents?
Yeah, I'm a parent of 2 Garrison Wildcats myself, kindergarten and first grade sons, and I understand the hesitation with anything that's new and unknown. So it's both a heart and a mind issue. And so we start with the mind part. There's so much misinformation flying around the internet and social media. And so we make sure that our families have accurate information, that know the vaccine will not alter your child's DNA and it's not going to cause infertility. And it is safe. And 200 of our children have already gotten it. None have had side effects more than a temporary sore arm and maybe a little fever. And it has kept them safe ever since they got it. So that's the mind part. And then the heart part is really just listening to and hearing their worries as parents and meeting them where they are and assuring them, as every parent wants to know, that my child is going to be okay.
Sure. I mean, you take on a dual role. You're principal and you're also very much a therapist. And believe me, as a mom, I love it when my principal talks to me, like a friend. It's very comforting. And, you look at the ongoing COVID crisis in many schools around the country now, and they're closing, they're switching their students to remote learning. What are you hearing from the kids? They want to be in school, right?
Absolutely. We've all come through such an ordeal over the past 2 years, and children and parents of young children most of all. And we learned the hard way in that first year that there is no shortcut or substitute for joyful and rigorous in-person learning. And it can be done safely, and that's where children need to be masked and distanced and in school with their teachers. Our children want that more than anything, and we're not going back. We're going to keep it safe, but we're going to keep them here, and the vaccine is one of the best ways to do that.
Well, we've been following you for some time, and aside from students and schools suffering, teachers are quitting, they're leaving their jobs, and in a virtual D.C. Council hearing in December, you actually testified that you're in a big need of more resources. Let's listen to what you had said.
Education is difficult, mission and values-driven work, and most educators do not get into it for the money. That said, when done right, teaching is literally brain surgery and deserves to be compensated as the highly skilled profession that it is. Combined with the recent move to multi-year principal contracts, our compensation helps us to attract and retain top talent. So I hope what you've heard from me is a strong vote for continuing to invest heavily in attracting top talent giving them the freedom and support to innovate and holding them to high expectations for student learning. Great people become force multipliers and create an upward pull that spirals beyond sight, changing the life paths of generations of children.
So true, Mr. Kip. I come from a family of teachers. I watched my parents for decades work so hard. They didn't make a lot of money, but boy, they cared about their kids and they cared about making a difference. And that comes through clearly as you testified there and even talking to you now. So give me your wish list. What kind of support do you and teachers need right now to teach our kids effectively during this pandemic? If you could just lay out, I'll take A, B, and C. Of course, we want to pay our teachers more, right? That is just a no-brainer. What else could help you in this time?
Thank you for asking. I think most of all, we want to be trusted and respected and given the agency and the space to do what we are highly trained and committed to doing, which is teaching children. And it's less so an issue here in DC and certainly at Garrison, where we have amazing families who trust us to do our work without interfering about curriculum or instruction. But I know that that's not the case across the country. And so to families out there in communities where teachers and schools are being second-guessed and undermined, please give us the grace and space to get your children's hearts and minds stronger every day without all of the noise and the politics. That's one thing. And then certainly the empathy of knowing that we are on the front lines along with law enforcement and healthcare workers, educators have been on the front lines since the beginning of the pandemic. And it is physically and emotionally taxing and exhausting work that takes a toll. And knowing that our families know that and are pulling for us is a tremendous moral boost that will help us to sustain in the work.
Well, it's clear you're giving a tremendous moral boost to your parents and to your kids. And I like that. Grace and space. That's a good mantra. Mr. Kip, thanks so much for being a vaccine advocate. And thanks so much for talking with us today.
Thank you, Kira.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.